This morning, we're talking about a minimally invasive treatment for brain bleeds, which are especially common in older people or people who are on blood thinners. Here with us is Dr. Daniel Villaduarte from St. Mary's Medical Center to talk more about this new procedure, new treatment. Welcome, doctor. Thanks for being here. So you were telling me that this is it's certain kind of brain bleed. So which ones are they?
So a subdural hematoma is that blood collection that accumulates between the surface of the brain and the skull. And it happens because the veins, as we age, they stretch, and any minor bump, any minor fall can just cause a stretching of those veins, and the arteries and the veins end up just oozing chronically over the time. And so there is an accumulation of blood in that space, and that causes symptoms just very, very gradually. The families sometimes think that after a fall or after a bump in the head, nothing should be done, but there are changes in consciousness sometimes, in personality, and that's how it happens.
Are there any symptoms for that type of brain bleed?
So the hematoma accumulates very slowly, and sometimes personality changes, memory problems, balance issues. Those are the very minor subtle symptoms that occur in patients with subdural hematomas.
So if you have a loved one, let's say, that falls and they seem fine, should you do something, take an extra step to make sure they're okay?
I think it's safe and prudent to, after a fall or any sort of minor trauma, to take your loved one to an emergency department to just make sure that there is no accumulation or there's no minor bleed or anything like that.
Okay, and you're here to talk today about a new procedure that's being done to treat these kind of brain bleeds. Before it was a major surgery, and now it's a minimal surgery.
So traditionally, these type of bleeds have been drained by our colleagues in neurosurgery, and through a minor incision in the skull, draining the hematoma, which can be life-saving in sometimes in some cases. In cases where the hematoma has accumulated, this blood collection persists under those layers, we go up with catheters to the brain, using the highways the arteries as highways, to just block the flow to the artery that is causing that constant oozing and that constant accumulation of blood and what's causing the hematoma.
That's incredible. The advancements that we've seen, right, in medicine. What is the recovery like for patients?
So when we determine that a patient is eligible for this type of therapy, the patient comes into the hospital. We perform this procedure sometimes under general anesthesia, sometimes under just a little bit of sedation medicine, and most of the time just one night, or sometimes just the patient can go home the same day.
Wow. And if people don't take care of these brain bleeds, what could that lead to?
They accumulate. The hematoma continues growing, and sometimes even though neurosurgery, my colleagues from neurosurgery can drain it, it reaccumulates. It forms and it keeps on growing over months. And so the symptoms sometimes are not so clear. And so the embolization takes care of the problem at the root. It's not only the draining, but it stops that artery that continues feeding the hematoma completely. We inject safely a substance, a polymer, to block the flow of the artery to where the hematoma is. And the benefits of that intervention are seen 3 months, 6 months down the road with CAT scans. And so ultimately the hematoma just disappears, the brain heals, and then the personality, the patient comes back to normal.
Wonderful, and I'm sure the loved ones love to see that. All right, thank you so much, doctor, for being
here with
us today. For more information, head to our website, WPBF.com.